Methylene blue, you may feel this that day when you're taking it. The way it works on so many different factors at one time is really awesome. We know that it works on what's called the electron transport chain in the mitochondria as an antioxidant, antibacterial, it's anti-inflammatory, prime nootropic is part of a prime nootropic stack.
Tell about effects of the BPC and what are its primary functions in the human body.
It's initially great for healing stomach ulcers, the way it may help with building muscle if used in conjunction, especially with the growth hormone peptide. It's now found in terms of skin creams. It's definitely the entry peptide for most people because it just has so many benefits, minimal side effects. With the BBC, they'll feel something. They'll say, wow, my gut feels better. My inflammation's gone, or my workouts are better.
I had a lateral collateral ligament damage, which was pretty bad. I used BBC, I used red light, infrared sauna. I feel like it worked. And the second time for GI restoration, it worked. I could feel the effect. So I can relate to what you are saying about it. Dr. Neil Paulvin, welcome to the podcast.
Thanks for having me on. Looking forward to it.
So hi everyone, my guest today is Dr. Neil Paulvin, a multiple board certified physician with certifications in anti-aging and regenerative medicine, family medicine and osteopathic manipulation. His practice in Manhattan combines traditional and alternative medicine to help patients for healthy living and performance. He has helped Fortune 500 executives, Olympic athletes, top trainers and A-list celebrities to optimize their health, recover faster from injury, and improve their sports performance. Dr. Paulvin is an expert in longevity medicine, peptide therapy, sports medicine, mitochondrial health, bioidentical hormone therapy, and the brain-gut connection. As a leading expert in biohacking and human optimization, Dr. Paulvin is recognized for his exceptional work applying a hyper-personal approach to help his patients move beyond the baseline. Neil, did I miss something that you would like to add here?
That's perfect.
Great. So you have very wide expertise in advanced longevity and wellness protocols for healing and weight loss and brain and cognition and the use of peptides too. So today I would like to cover some of the emerging therapies in health and anti-aging, namely methylene blue and its applications for cognition and mitochondrial health and maybe even skin, how it compares to some other nootropic protocols and maybe mitochondrial peptides. I'd like to cover some other peptides too, like cerebrolysin and BPC. And if we have time, maybe discuss weight loss peptides and their applications. So there's a lot to cover. Let's see what we have the time to do today, okay? Does this sound good to you?
Perfect. Definitely. Let's hit all those topics. I get asked about them every day.
Awesome. So let's start with methylene blue. It's gaining traction as a very versatile compound with numerous health and wellness benefits, especially at daily lower doses. And it's also quite readily accessible, at least here in Europe, especially in oral forms and sprays. So why would you say there is such a stir around methylene blue at the moment?
I think because it's something that has many uses. Like you said, it's low dose. Most people don't have side effects unless they are on some type of antidepressant or they have something called G6PD deficiency. They feel it right away. A lot of people will take a supplement, no matter what it is, a peptide supplement, whatever. And sometimes a lot of them may take 4, 6, 8 weeks to kick in, and people don't have the patience for it. And methylene blue, you may feel this that day when you're taking it. So I think it's just a lot of different things about it. And just the way it works on so many different factors at one time is really awesome. So I think it's a lot of different parts that make it work.
Right. So maybe for those who don't know, could you explain what exactly is methylene blue and where does it come from and how does it work within the human body?
Sure. It works a lot of different ways. It started as a dye they used to do in lab work, and then they started using it, at least in the United States. They used it for a couple of medical conditions in the emergency room, and they found effectiveness in doing that. And it works a lot of different ways. We know that it works on what's called the electron transport chain in the mitochondria. The mitochondria in the body produce energy as an antioxidant, especially in the mitochondria. Again, when the mitochondria works, it produces what's called oxidative stress, and a little bit of oxidative stress is actually good. With any process, I kind of way explain to patients, you want to may have a little bit of spark. That's okay. That means the body's working and it's working well. We just don't want those sparks to get too big and cause a fire, and that's what it's really helpful with. Then we kind of found other things that it's very useful for. We now know that it's antibacterial. It's antiviral. And as you mentioned in your intro, it's now being used as one of a prime nootropic, as part of a prime nootropic stack, because it increases neurogenesis in terms of improving neuron generation. It's an antioxidant, which happens in the brain. We know that people who have problems with the brain have issues with their mitochondria. So again, it works on the mitochondrial health. It's anti-inflammatory, and it may improve mood. So there's a lot of things and a lot of different mechanisms, and they all work a little bit differently.
Right. So there was a lot of benefits there. So antioxidant, neuroprotective properties, memory, cognition, mood. Who would you say is a good sort of candidate to try Methylene Blue as a part of their health regimen? Or is it sort of a safe peptide to try for everyone? Or sorry, safe compound?
I think, again, except for those two little caveats there, that if you're on antidepressant or have GP60, which we usually will test most people for ahead of time, then anybody can take it. It's just the key is there's some people out there still touting it at high doses, where we're finding a lot of the efficacy starts at low doses, and you may increase your oxidative stress and inflammation by taking it at high dose unless you need to. But otherwise, it's a pretty safe compound.
Right. So what are the typical sort of low doses versus high doses?
So the way we break it down, unless you're dealing with an acute illness, either neurological or infection, we usually recommend patients start around potentially between 4 and 8 milligrams, and then we titrate the dose aggressively as we need to. I have patients take it every other day, unless they're taking it for an acute illness at max. There's some people who find it very energetic and they only need to take it once or twice a week. Other people like taking it potentially 4 or 5 times a week. It's finding that sweet spot. But it reacts with people differently. But usually I start between that 4 and 8 is the sweet spot.
Right. So you mentioned that people in antidepressants should not use it. So Methylene Blue inhibits MAO-A and MAO-B, but so it basically leads into increased serotonin. So if you are SSRI, that might lead to serotonin syndrome, for example. But is there any other like downsides, maybe some side effects or something that it may have negative side effects with Methylene Blue?
In terms of people on antidepressants, or just in general?
In general, like I've heard some people get a little bit anxious, for example.
People will get more too energetic because of a combination of that. One, because of the way it works on some of the neurotransmitters, because it's anti-inflammatory, produces ATP and works on the mitochondria. And then people will rev that up by doing things like red light or other mitochondrial peptides or supplements, and they just become very anxious or hyper and can't sleep, or just very fidgety and can't focus. So that's why we start at low doses and not have people take it every day. There are people who just can't, do get a little bit too agitated with it and can't take it. But I only have maybe out of hundreds of patients, one patient who had that reaction. I mean, I tend to do genetics on my patients, so I tend to know who has some of those anxiety genes or issues with breaking down neurotransmitters. So I kind of have a heads up. But if you're an anxious person, you definitely want to start really low and make sure you're working with a doc who knows how to watch it for you.
Right. I wonder if it would work well with something like L-theanine, if that could balance the effect.
It has to be something heavy. Do methylene, people who unfortunately have that side effect I've seen or heard from other people, it's pretty strong usually. So they usually end up having to go on either like a medicine for a couple of days if it's too bad, or they just have to wean it off. Theanine, this doesn't work as well. It's a pretty strong side effect, unfortunately. So there's very few. I mean, DHHB I've seen work once or twice for patients. Or maybe if you want to combine the DHHB, theanine, like GABA sometime. Again, you could try a natural way of doing it. It just may not be strong enough to overcome it. But again, I see it very rarely, and that's for people who usually take high doses every day or too high of doses every day. Usually if you dose it right, I've had nobody have an issue. I had one patient who had an issue short term, and then we just brought them down and they were fine. I think we're learning now how to dose it. I think when anything new comes out, people just want to go high and go really fast with it. And now we kind of know where that steady state is, I think.
Yeah. Okay. That makes sense. So is it something you can take every day?
Only time I have patients taking it every day is if they're dealing with a neurological issue or an acute infection for like 2 to 3 weeks. I have them take it every day. But because of I find that people take it every day that doesn't work as well. They get kind of a tolerance to it, as well as they get more side effects. So I find most people are better off taking anywhere between 3 to 5 times a week. And it depends what people are taking it for. If you're taking it for energy or for as a nootropic, most people on the weekends don't need to take it anyway. Or if you're taking it for energy, again, you know those days that you need to take it. So I don't love patients taking it every day. I very rarely recommend it.
And are there different kind of administration routes? I mean, here you can find methylene blue in like a liquid form, but do you use it intravenously as well?
My preferred are the pills and the NIV because those are regulated. There's companies and docs have done studies on the droppers and the liquids and the nose sprays. And when they're tested, it's not the dose that people are thinking it is. Usually it's lower. And then 2, there's other toxins or some type of preservative in there. So they're getting other side effects from it. But there are people who choose like the liquid and don't like swallowing pills. But again, there's a little more risk factors to those other formulations. There are some skin creams out there now that people like, which have minimal side effects to it. But we're still waiting a little more data on how much the skin cream is really helping.
Okay. Yeah, I've seen some interesting research about the anti-aging potential of methylene blue on skin longevity. And like in skin culture models, it's been effective in increasing the dermis thickness and skin hydration and skin proliferation. Do you have any experience on these kind of creams or any advice on them?
Yeah, I mean, I've seen the studies that you're pointing out. We're still waiting from kind of better, like a little bit larger studies. Plus, we know again, mitochondrial damage affects skin. It's anti-inflammatory, so it probably will work well. It's just finding the appropriate formulation to work, the appropriate dosing. Obviously, I know one product actually had left the skin tinge a little bit blue. So I think it has great potential in that aspect, especially in combination with other skin creams. I just think it's going to be finding that who does it the best. But I think it has great potential.
Right. Yeah, I haven't actually found anything, especially here at the Europe, that uses methylene blue in their skincare products. So
yeah, there's 2 that came out in the U.S. They're mixed. One's mixed with NAD. One's mixed with just I think like retin-A or something. So people have liked them short term, but that I'm still I want a little more information first. I think it's going to be 2 of the companies that I really like are potentially coming out. So I'll wait for those to come out probably more to really recommend it. But we'll see. Again, I think it's methylene blue. It's getting more popular almost than anything else out there right now. So I think the development is expedited.
Right. So something to keep an eye for the future. You use methylene blue in your brain protocols. What other therapies do you combine it with, especially like counteracting stress and brain fog and boosting cognition?
I use a lot of stuff now. I mean, the top ones are we're using it usually with Cerebrolysin, which you mentioned in the intro. We will use it with some type of cognitive therapy, meaning we'll either be usually we're using some type of red light helmet, or red light in general, and or hyperbaric therapy. And then those are probably, the big things that we're using and that we use consistently on every patient. And then we're trying to treat, again, depending what the issue is, if it's brain fog, if it's hormones, if it's inflammation, if unfortunately you have early demonstration of neurodegenerative lab work, we're going to target that a little bit more. So there's a lot of different variables, a lot of great things out there that we can use now. Exogenous ketones, use a product called plasmalogens, or a product, I don't know if I can use name brands on your podcast. Some are really been shown to really be helpful as well. And then we mix and match some other stuff. I love a peptide. There's another peptide called, you mentioned BPC, SS-31, which is the mitochondrial peptides. Again, we mix and match about 6 or 7 things at one time. And then a lot of it depends on what the lab work is showing and what the patient's goals are. Are they more just trying to optimize brain health, or are we treating a specific issue? Again, what's available now compared to even 2 years ago is amazing.
Yeah, it seems like there is so many options these days. What about IV vitamin C? I've seen some studies kind of using it as an alternative for methylene blue. Do they have a synergistic effect, or have you combined them?
I haven't, for some of the reasons. I mean, we do high dose. It can, depending on what dose you're doing, it can increase oxidative stress, which is why you're doing it in certain cases. I've mixed it with low, a little bit kind of lower mid dose. I haven't seen as much benefit as other people have. More people have side effects with the vitamin C. So it has been, I could see where the synergy is based on the mechanisms in terms of how the different dosing of vitamin C works. But I just find other IVs are better. Again, the Cerebrolysin's better, the methylene blue is better. If we're going to target, again, we can do NAD, or we can do other things mixed in there as well, like some of the peptide IVs. So I just think that I just haven't seen it. It's not as strong as I'd like it to be. I could see the potential if somebody can't tolerate the methylene blue because they're on an antidepressant, they're sensitive to it, and then I could see that as a nice change that regulates the immune system. It can be antioxidant. It just doesn't have some of the mitochondrial benefits to it. So you have to add something in to do that, which you can definitely do. It has potential. It's just, again, that's what makes methylene so great. It does so many things with very minimal side effects.
So you mentioned some mitochondrial peptides like SS-31. Can you tell us how these differ mechanistically from, for example, methylene blue? And yeah, how do they compare?
Yeah. So I mean, the ones that are out there now, you have MOTS-c. They're all mitochondrial proteins, mitochondrial peptides that are found in the cell. I mean, SS-31 or ipamorelin is in the mitochondrial membrane, works on cardiolipids. It's a very strong antioxidant. That probably now has some of the most broad benefits. There's studies now how that's neuroprotective. It may help patients with Parkinson's or Alzheimer's. We know that it helps tendinopathies. It helps with heart health. It may help with lung health. So that's probably the most potent mitochondrial peptide. And again, it works very well in conjunction with the methane blue because they have different mechanisms. MOTS-c, which in the U.S. has become harder to find recently, so we don't use it as much anymore, has a lot of benefits in terms of it's an AMPK booster, which is going to help with energy, can help with weight loss, helps with bones, so it helps more systemically. There are some potential brain benefits, but not as much as SS-31 or methylene blue, but it's a nice add-on. Humanin, which is kind of an older one that we've kind of adopted recently since we haven't been able to get MOTS-c as much, at least in the United States. That could be done either as an injection or a peptide, an injection or a pill. That helps to replenish it. That's something I tend to only use short term. It does improve neurocognitive benefits, does not work as much on the electron transport chain, or it works again differently than the methylene blue does. But it's a short term peptide that we use just because of potential side effects to it. Patients can actually have like brain fog, fatigue from it. So we tend to use it less frequently than the other two. So they all work a little bit differently than methylene blue, but they all complement the mitochondria in some way. So again, they're great in conjunction, or a lot of times we'll do methylene blue for a month or two, and then maybe switch to one of those peptides.
Right. So they are more for longer term benefit, whereas methylene blue gives like an immediate brain boost, if I've understood correctly.
In terms of brain specifically, if you want to look at it that way, methylene blue is going to be more long term, and then the mitochondrial peptides are going to be shorter term, really kind of doing a lot more of the heavy lifting in certain cases, especially like SS-31. In terms of brain, that it's gonna something you're gonna take for 2 or 3 months, moderate to high dose, and then you're gonna hold off on that for a little bit, and then you're gonna continue doing methylene blue for a while. So it'd be almost a flip is how we pursue it in terms of brain issues, because the methylene blue we can just continue to use, and we don't see the plateauing as much as you do some of the other peptides.
Right. I just realized we should probably rewind and play again a bit from what is a peptide. So for those who are not that familiar with the word peptide, What is it? Are they natural, and how are they different from, let's say, a supplement or a pharmaceutical?
Yeah, so peptides are proteins. They're small proteins, and anywhere from like 2 to usually a little bit over in the low 100 amino acids. They work on either cells or enzymes or in a specific area of the body and in a specific organ of the body to produce certain effects. They are available in cream or injections or pills or IV. And again, they pretty much can affect any medical or optimization process at this point. I mean, there's for muscle building and inflammation, there's for weight loss, there's for brain health, there's gut health, there's the mitochondrial peptides, there's immune boosting ones. So they're really great, and they also work really well with other supplements or technologies. They don't have to be done by themselves, and they usually have very minimal side effects.
One of the most common, actually Googled things about peptides is the question, are peptides safe? So people are concerned about peptide safety. What would you say are the main safety concerns or considerations associated with peptides, and what is your comment on this one?
Yeah, so I mean, this has become a huge kind of rabbit hole. Right now, so there's kind of 3 layers to it. I mean, anything that you're going to put in your body between the supplement or prescription, you're going to have potentially reactions like risk of allergy, risk of inflammation, risk of just general pain and side effects, which with most peptides is pretty minimal. Then you have the issue with, like I mentioned, there are ones at least that are, and throughout the world, they're done through pharmacies that are regulated, that are checked to make sure that they are what they say they are. They're sterile. There's no toxins or something that could seriously harm you. And then you have the actual peptide themselves, where there's some hypothesized concerns. None of them have really bared in any studies yet, and they've been prescribed millions and millions and millions of times. The ones that people are concerned about are CJC, because anytime or any of the growth hormone inducing peptides, there is a hypothesis that you work on inducing growth hormone, then you have an increased risk of cancer, which is, again, it's an hypothesis. These are not, a lot of patients who do take them do not get a specific raise in their growth hormone. They just have raise in terms of how the growth hormone boosting effects. But that is also why we'll tend to do those types of peptides for 2 or 3 months at a time, and then have patients stop for 2 or 3 months to limit that type of growth. The other one that's come out in a lot of the podcasts, concerns with BPC 157 because of the proliferation of blood vessels and then the quote unquote cancer risk. I mean, again, this is a peptide that's been used for 15, 20 years with no proof of that. There are a lot of other things out there that can do similar things. Again, that's why we tend to only do it for 2 or 3 months and have patients take a break. It's not something that we use in perpetuity. So it's a lot of this stuff, because we're now waiting for more and more human studies to be done. We don't know some of these things for sure. If these things are a dramatic concern, then you don't have to choose the growth hormone peptides or BPC. I mean, some of these peptides have been used in Europe and Asia for 50 or 60 years, since like the 80s. That's where some of these have been developed from. So we know they have pretty good safety protocols, but those are the kind of the 2 ones that people are concerned about. But almost all peptides, we tend to cycle them, meaning that, again, you're on it for 2, 3, 4 months, and then you're coming off to limit any risk of any long-term side effects.
Right. What about the sourcing of the peptide? Is there any risk associated?
Yes. I mean, we at least in the United States, we tend to recommend pharmacies that are what are called compounding pharmacies that are regulated by the state, and they're getting tested to make sure it is what it says it is, and there's no real serious any type of toxins or byproducts in the product. In other areas of the world, there are certain manufacturers, depending on what peptides that are the main kind of manufacturer. Like there's Everpharma is the one, I think they're in Austria and Western Europe, that make Cerebrolysin. They're the people who make it. They've made it for 50 years. We know that they're the name brand. If it's not a peptide that's made by that main pharmacy that should make it, that should put a concern in your head, and then you need There are people who actually will send their own peptides out for testing to confirm that before they take anything from any other company. If that's available to you and it's become a lot cheaper, that's something to consider. That you check to buy one or two peptides from whatever company you're curious about, send them off to be authenticated. If they are what they say they are, then you can continue using that company. And I know I have multiple patients now who do that. And I know in the US, there are going to probably be some services that will offer that to patients because it's becoming more and more of a concern. Peptide use is just growing.
So I guess it's safe to say that the safest approach is to work with a clinic like yours that peptides and know the sourcing and know where they come from safely.
Exactly.
Okay, so in your Instagram, you mentioned that Cerebrolysin is one of your favorite peptides. So it has many, you mentioned as well, like neuroprotective properties, and research shows it's beneficial in like stroke, TBI, Alzheimer's, also used for that in various countries. So it's kind of an interesting peptide derived from pig's brain. Can you talk about that one? What's the mechanism?
Yeah, you give a very, very complete summary there. So yeah, it's derived from pig's brain. It has many different neuropeptides in one. It has P21. It has, I think one's actually called like just pig1 neurotropic enzyme. They have like multiple different ones in there that help regenerate the nerve, that help decrease the inflammation, to help BDNF, which is the brain-derived neurotropic factor, which helps with neuroplasticity. So it works kind of like a full recipe of different brain peptides to help heal the brain and then optimize brain function. It's something that, again, was derived in the 80s and has more data than some of the other peptides that are out there. We've just seen really amazing results with it in terms of use.
Right. So who is the ideal candidate for using Cerebrolysin?
The main two people, patients who, well, I guess there's three real categories. We have people who use it just as a nootropic. They use it with methylene blue for a month. They use it methylene blue or RG3, or they're using with CMAC, whatever. Again, there's a lot of different nootropics out there at this point. That's the first group. The second group, people like you mentioned, kind of briefly, patients who like things like brain fog or very slight memory issues. They find it very helpful. And then we'll do high dose with patients like patients who have Alzheimer's, traumatic brain injury, Parkinson's, things like that. So depending on who we're trying to treat depends on how long the treatment's going to be, what dosing we're using, if we're doing IV, how many IVs they should be getting it over the course of a week or so. So
right, you prefer the intravenous for intramuscular.
I just prefer it because especially for patients who are dealing with an illness, the dosing is 10 times what you're going to potentially up to 10 times stronger than what you can do intramuscularly. So I just think I've seen very few patients get any benefit with intramuscular. I have patients who will do an IV once or twice a week, and then we'll mix in intramuscular on top of it, and they'll get benefits. But just to do a solely intramuscular, I just have not seen huge improvement in like patients who have brain illness.
I'm curious about the dosing. There was a study that suggested that actually lower doses, like 10 milliliters of intravenous cerebrolysin, was more beneficial for cognition in AD than a little bit of higher doses. What's your experience in dosing in general? Which kind of doses seem to be beneficial?
Yeah, there's studies on both. The recommended from the main companies is anywhere between 20 and 50. So that's what I tend to go with. It depends on the patient, but I've very rarely have seen improvement at 10 if it's a true cognitive issue. I tend to start seeing at 20 and then up to 40 or 50. So I tend to push higher in cognitive patients. I find that that's what works for them. I'll use 10 only, again, if somebody's injecting themselves.
And is there any side effects with cerebrolysin?
Very rarely. Obviously, if you're sensitive or an ethical objection to pig is the main thing. I've had nobody have any other issues except for sometimes if we push a dose too fast, they'll get a little brain foggy initially, and then it wears off within like a day or so. but I really have had nobody have any side effects from it. Most everybody will feel it right away, which is also kind of great because it means we know it's working. But I've had, of all the peptides, it's one of the ones that I had the least amount of side effects with.
So if one would use it for just the general nootropic benefits, or let's say some sort of post-COVID brain fog or stress-induced brain fog, how many times do you need to use Cerebrolysin and how often?
Again, everybody's different. I mean, I would say I would still go pretty hard dose for about 2 weeks or so at least. And then they also should be doing other things, usually in addition to that. Again, depending if it's COVID, you're doing a COVID protocol. If you're doing it because of just a traumatic, again, depends what initial cause is. But usually we're going to do it, I would say, at least 2 to 3 weeks is going to be the sweet spot. The good thing is it works so quickly is you kind of get an idea where the patient is. They say after the second week, wow, my brain feels 80% better. Then you can usually kind of know, okay, about 2.5 weeks, we're good to go. And then we'll just have them do injections at home. It's things like this, it's just amazingly variable. Like I know with like BPC or TB4, I pretty much know almost exactly how long it's going to take. But with Ceberolysin, it's again, based because the brain is so complicated, it's all, I would say usually it's a minimum of 3 weeks of treatment for almost anything, just because of the way it works.
All right. So you mentioned BPC just now, and that's also one of the most, I think, versatile peptides, probably one of the most popular ones out there. So tell about effects of the BPC and what are its primary functions in the human body.
Sure. BPC's body protection compound is derived from the stomach acid. It was initially great for healing stomach ulcers, issues in the esophagus. And then they found also that it had the amazing ability to decrease inflammation throughout the body, potentially help to build muscle because of some of the blood flow benefits, as well as the anti-inflammatory and healing benefits of it. We know that it increases growth hormone receptors, which is also why it may help with building muscle if used in conjunction, especially with a growth hormone peptide. It does affect some of the neurotransmitters. So some people find that helps their mood. Because of the anti-inflammatory effects, we also have used it kind of as an add-on for the brain. And saying that we now use it, it's now found in terms of skin creams. So there's a lot of different uses that it works. Again, it works. Some people use it as a cream. We've also could inject it into somebody's knee if they have arthritis and help decrease their inflammation and help with their arthritis. So it's a very multifunctional type peptide. And again, it's available in just every formulation humanly possible at this point.
Right. It almost seems like a good entry peptide in the peptide world, if somebody would like to experiment with.
Exactly. It's definitely the entry peptide for most people because it just has so many benefits, minimal side effects, and they'll feel it. It's that's with some of the peptides, like the mitochondrial peptides. Some people say, well, I don't feel it, even though if we'll do some testing, we may see things. With the BBC, they'll feel something. They'll say, wow, my gut feels better. I'm not as bloated as I used to be, or my inflammation's gone, or my workouts are better, or they'll find something that helps how they feel.
Yeah, I've actually used it twice for myself, sublingually to I had a lateral collateral ligament damage, which was pretty bad. And I used BPC, I used red light, infrared sauna, physiotherapy, of course, multiple supplements to help to repair it. And I feel like it worked. And the second time for GI restoration as a part of a mold illness recovery. And I feel like it worked. I could feel the effect. So I can relate to what you are saying about it. Do you think one of the forms, like oral, injectable, or sublingual, is better than other? Or do they have different applications for different types of repairs?
I mean, I'll always say for most things, the injectable is still the best. There are people who think that the pill is better for gut issues. And I'm still 50-50 on that. It depends on what else we're using it for. But because of some of the other combos that are out there now for gut, we'll tend to maybe mix it with those in one pill or 2 pills. But I'm still pro injection in most cases. But the pills have gotten a lot better over the last year or two, where the pills used to be very like 50% as effective as a shot. Now I'm finding there's some of the formulations are 85% as good. So it is helpful for patients who just don't want to shoot themselves every day, or patients who travel a lot and don't want to have to worry about refrigeration. We're finding that the pills are still giving them some pretty decent benefit. We may just need to up the dose a little bit.
Okay. What would you combine the BPC with?
So if we're doing gut, it's KPV and lorozatide. If it's muscle weight, weightlifting stuff, it's start with TB4 and then adding in CJC and ipamorelin, which they call the Wolverine stack after the Marvel character. If we're doing brain, then you're mixing in either Cerebrolysin or SS-31. So it just depends on what area we're targeting. If you're doing skin, you're doing GHK. Again, it just mixes so well with almost everything that's out there.
So is there a topical BPC?
There is. There are some topicals out there. Yeah, it's for inflammation. They say it may decrease inflammation, can build collagen. It's a nice add-on. It's not, of all things out there, it's not the best, but it's a nice add-on for people. But I usually recommend using it in combos, because there's only so many things how many different creams you want to put on your face at one time.
Yeah, true. So you have mentioned growth hormone a couple times. Obesity is clearly an increasing epidemic in the US, well, also around the Europe increasingly, and weight loss peptides are gaining attention, particularly with the rise of GLP-1 agonists like Ozempic and the popularity of those. So how do peptides work for weight loss? There are a couple different mechanisms. Maybe we can discuss those.
Sure. I mean, the first question, technically, people sometimes group like the Mounjaro, the tirzepatide, and semaglutide as peptides. They're not true peptides. So we'll probably take those out of the equation initially. Because of the onset of the GLP-1s and now the GIPs and all the other ones that are coming out, these guys have kind of gone to second or third class citizens at this point, but they still do work. They're just not as strong as the prescription medicines that are out there. But there are ones like Tesofensine, which works on the brain, the neurotransmitters that are effective. Amlexanox, which works on insulin sensitivity, similar to how the other medicines work, but it's not as strong. It will help lose several pounds. It's also great for inflammation and mast cell and things like that. The only downside to amlexanox is it's 3 times a day as opposed to once a day for tesofensine and some of the other products. There's 5-amino-1-MQ, which is an NMT inhibitor, which works on kind of NAD boosting and other factors that has been effective. And then there's also, I'm missing one off the top of my head, AOD, which is the growth hormone offshoot, which some people think is the best thing ever. Other people say they got bloated with it and will never use it again. Because it works on a hormone that it may cause some bloating and to get hangry, meaning that you get like angry and hungry at the same time. So they're all good.
That's one of the most effective for fat loss, right?
They think so. There are, again, like right now, if you ask a lot of docs don't use it anymore because we just have not seen what the marketing says in terms of AOD. I use it more for joint than I use it for weight loss at this point. I don't think it's that effective. I think the other one, Tesofensine, amlexanox are all better than AOD. And that tends to be kind of the other people's opinions at this point. A lot of us use the peptides a lot. Again, AOD is kind of, I don't know what the best analogy would be, but there are still people who think it's the best thing ever, and they love it, and they'll never stop it, and that's fine. And I'll continue prescribing them for it, but it's probably my last go-to of all the weight loss peptides that are out there. I'll use Low Dose Naldextrone. I'll use, again, obviously all the Ozempic and Mounjaro and medicines like that. And then I'll go to AOD, unless they want to work a little on hormones, weight, building muscle, have a joint complaint. I'll say, okay, we could try the AOD and see, but I just haven't. Again, I think more people stop it than find benefit from it. At least in my patient population, and other docs have kind of said the same thing.
Right. Do you think that there is, or do some peptides work better? If we think about that the outcome goal is like weight loss, But then some people may need to lose more fat, whereas for other people, it's important to increase muscle. What peptides target fat loss? What peptides target muscle? And how do you combine these as a weight loss protocol?
Yeah, I mean, it obviously depends on what we're dealing with. It depends. Are we dealing with somebody who's insulin resistant? Are we dealing with somebody who never went to the gym in their life? Are we dealing with somebody who is somewhere in between? So yes, it's a little bit of combination. That's where AOD would potentially come in terms of somebody who's trying to build a little muscle. We probably would mix it with like a BPC or a TB4. And now it's a new product that just has been out for a while in the bodybuilding community that's kind of become more readily available, called Sloop, which also does that really well, which helps you build muscle and lose weight. It's really strong, so we don't tend to recommend that to some patients, but it does work really well. Sometimes we'd use CJC, ipamorelin, which will help build muscle and help with a little bit of weight loss as well. So for the patients who need both. If we need people who their insulin numbers are through the roof, then again, we're using more of a MOTS-c, or we're using amlexanox. It depends on what we're doing. It depends on the lab, but the easiest way to lose weight in most cases is to build muscle and get the hormones regulated, be it your female or male hormones, or be it your insulin sensitivity or resistance. I mean, that's part of it. I would say then the other part is getting the diet in check. But most of my patients, when they've already seen me and want peptides, they have the diet on check. I don't tend to see patients who just want to sit on the couch and lose weight by taking 17 things. I just don't think that's sustainable or makes any sense.
Yeah, so you would combine peptide therapy with, do you think it's a prerequisite that you first did diet or you first started exercise?
In a perfect world, yes. Some of my patients need that kickstart. They're like, I can't exercise because I'm 300 pounds and my joints hurt. So sometimes if you do, again, any of the things that we've discussed, and they can lose 5, 10, 20 pounds, and like something like a BPC where we're decreasing their inflammation, so now they can go walk around the block, or they can go to the gym and do it successfully, and then things snowball in a good way. So sometimes a lot of patients just need a little push. So there are cases where we just have to get them started on other things first. Because if they're in too much pain, they're on the couch, they're depressed, they're eating, and you can't get that diet in check unless you fix some other stuff first. But in most cases, that's what we're trying to do.
Yeah, that makes so much sense. That it's kind of like this positive reinforcement cycle. They see that it's possible because so many people struggle with their weight for years and years, and it's almost like a psychological bias of thinking that I cannot even physically lose weight, and then they see that something starts happening actually. So that might give a nice motivational boost for trying other things as well. And of course, the physiological capability of doing that as well, with more energy and lower inflammation. Do you need to be on a weight loss peptide forever? Is the effect long lasting? Once you stop the peptide, does the effect stop?
Well, with any weight loss situation, no matter what you're taking, number one, your lifestyle changes have to be on point no matter what. So it's got to be the exercise, the diet, the sleep have to be on point, or you're going to gain weight back no matter what. In most cases, the meds are temporary. They're going to hit that plateau no matter what. There are people who will do it for a year. They stop for a year and then they find they need to go on something again. But most cases, the goal is to be on it for anywhere from 3 to 9 months and then come off of it in theory. I mean, some people need to be on it for a year depending on how much weight they need to lose. I mean, the only meds that we're using long term are the people who are microdosing things like the GLP-1s like Mounjaro and Ozempic. There are people who are going to be on those long term. But if the peptides specifically, they're usually going to come off within like 6 to 9 months.
Gotcha. Okay. How about targeting specific areas? So there are many people who are normal weight, but they have too much visceral fat, for example. Can you use peptides to target that?
Yeah, I mean, the best peptide for that is Tesamorelin. That's what it's used for. It's actually in the US is a prescription medicine for that. It does work really well. It's really strong, but it has been shown to lower visceral fat. So that's the one that we would recommend for that. Sometimes the other growth hormone peptides like CJC can do that, but Tesamorelin has studies showing that it does lower visceral fat.
Okay. can you use peptides preventatively? So to, let's say, many women face in menopause that digestion and metabolism slows down because hormones decline. Could you start peptides to prevent some of the age-related weight gain, possible weight gain?
You can. I mean, usually someone like that is it's kind of more of a bundle. What I mean by that is we have patients who do, like, beginning of the year, do what we kind of call a peptide reboot. So they may do a CGC and a BPC once or twice a year for 2 months. Like in every January and every July, they'll do it for 2 months to get all the benefits, the brain, the skin, the energy, and potentially the weight. So you can. But so it will work, the way I explain a lot of this stuff is if your gas tank is 95% full already, it's only going to work so much. So again, it's great that women are trying to prevent the side effects of menopause, but if your hormones are pretty good, again, you'll get some benefit, but you may not get the same benefit you will as if you need it 5 years from now. But it can be done. It just, some people it's a great thing. Other people they're going to get minimal benefit from it because they have really good health. But a lot of people will do, like I said, like a reboot, like once or twice a year.
Thank you so much. I think we have covered a lot. And as we're coming to the end of the podcast, I just wanted to guide people to look at your Instagram and your YouTube. You're active in YouTube, you're active in Instagram. The education is next level. You will not find that information in Googling. So go and check Dr. Neil Paulvin's socials. And would you mind sharing the links for your webpage and Instagram and the handles for YouTube as well?
Yes, thanks. So yeah, I mean, the website is doctor spelled out, doctorpaulvin.com. The YouTube and the Instagram are both drpaulvin. That's where I tend to put everything and links to everything else, like newsletters and stuff like that. So those are the areas that really have the most up-to-date and information that's out there.